What brought me to physical therapy was to balance. Was my back was going bad. I was in a car accident back in September of last year. The pain didn't go away. I was told that it was going to go away within a few months on its own. It didn't, and then I started working here with Jack. My first impression of physical therapy, I have actually been to physical therapy in the past. I have done I've had two shoulder injuries, but the setting was completely different. So when I came into here, I felt like it was a gym. Like that was my thing. I was like, whoa, this looks like a gym. And I didn't know what to expect. It was completely the opposite of what I had done before. My impression, I enjoyed it. They work with you a lot. Not only does your main physical therapist, but also their assistants. They're very wonderful, and they've helped me out too when it comes to like the workouts and like little things here and there. Um, they're always very helpful, all of them. With balanced physical therapy, I learned a lot about stretches, and I learned also a few new workouts. I learned more about what areas of my body I need to focus on to improve. Yes, my lower back was the main point, but also to where what more certain muscles need to be either worked on and stuff like that, so that way I could get the strength and get back to where I want to be. What I would tell somebody who's going through some kind of pain, uh, depending on regardless of what it is, I would tell them to come to physical therapy, because like myself, I'm 33 years old. My injuries were when I was in my early 20s, and I realized that when I was in my early 20s, it was easier for me to recover, get back into fitness, and just continue going on with my life, my day to day. And as I got older, as like I said, now I'm 33, I'm noticing that my recovery has been taking a little bit longer, and now I'm a little more careful with the type of workouts that I do, so that way I don't pinch or hurt anything. And I know that many times people have the fear of coming to a doctor or even coming to a facility. I know I did at one point, but I would definitely recommend somebody to come and get seen, so that way they can go ahead and feel better and just keep progressing.